So let's break this down really quick. When your blood sugar is too high for a long time, it's like having syrupy, sticky blood flowing through your body. And this extra sugar can do a couple of things. First of all, it weakens your blood vessel walls. Picture this. You just left your doctor's office after getting you information about your diabetes. Maybe they reviewed your lab work or laid out a plan, but now you're walking out feeling confused and anxious or even frustrated because you still don't know what to do next. You glance at that printed summary that they handed to you at the end of the visit. It's full of words and instructions that don't really answer any of your questions. Does this sound familiar? I get it, managing diabetes is overwhelming, and when they add that your risk for heart disease is even higher because of your diabetes, it's a lot to take in. Today, I'm sharing the most common questions people ask, gathered from social media, conversations I've had as a nurse myself, and real-life experiences from people like you. These questions can help you connect better with your doctor and take control of your health. Let's get to it. While there are a ton of information out there in the land of social media that are really very helpful, they don't necessarily answer the questions that you might have that's specific to your condition, your needs, and your preferences even. Your provider knows your medical history, and so it only makes sense to know what questions to ask your provider to get that more personalized answer just for you. And so on this channel, I'm here to help you navigate chronic conditions like diabetes so that you're confident about making healthy decisions for your health. And my goal here, my friends, is to just empower you to take charge of your health journey. If you aren't aware yet, diabetes increases your risk for heart disease. Managing blood sugar is only part of the picture, and protecting your heart is just as important, especially when diabetes increases your risk for heart disease. So these 5 questions that I came up with will help you talk to your doctor about how to keep your heart healthy while managing diabetes. And my hope is that these would encourage you and motivate you to continue to ask questions whenever you need to have more clarity from your doctor. And please note that this video is for informational purposes only, and it's not medical advice. Always consult your doctor before making any changes to your health regimen. I needed to add that disclaimer there. Question 1. How does my diabetes affect my heart health? So diabetes isn't just about your blood sugar, it actually affects your heart too. Over time, high blood sugar can damage your blood vessels and lead to plaque buildup or fatty deposits, which increases your risk for high blood pressure, high cholesterol, heart attack, or strokes. So when you meet with your doctor, you always want to ask, well, how does my diabetes affect my heart health? And this question opens up an important conversation about how diabetes specifically impacts your heart. And your provider might go over the need to manage your blood pressure, or your cholesterol, and your weight. And they can recommend strategies like eating a heart-healthy diet, which I'll go over in another video, getting more active, or even medications that can lower your risks, which is another topic of another video. And so the American Heart Association stresses that understanding the link between diabetes and heart health is so important to prevent serious complications that I've mentioned already, heart attacks and strokes. It's all about taking proactive steps to really protect your heart. So let's break this down really quick. When your blood sugar is too high for a long time, it's like having syrupy, sticky blood flowing through your body. And this extra sugar can do a couple of things. First of all, it weakens your blood vessel wall. So high sugar levels make the walls of your blood vessels less flexible and more prone to damage. Think of it like overstretching a rubber band until it becomes really brittle. And then this can cause inflammation. So excess sugar irritates the lining of your blood vessels. It causes that inflammation. So imagine sandpaper rubbing on a smooth surface. It creates those rough patches, and this leads to plaque buildup. So damaged blood vessels attract the bad cholesterol, the LDL, which sticks to these rough patches, forming these plaques. And these plaques narrow your blood vessels, making it harder for blood to flow through. And this restricts your blood flow. So then over time, the narrow blood vessels reduce blood flow to vital organs like your heart and your brain. And then this increases that risk of the heart attacks and the strokes. All of these increase the pressure of your vessels. Since blood has to push harder to get through narrow damaged vessels, it can lead to high blood pressure, which then strains your heart even more. So again, managing your blood sugar helps keep your blood vessels healthy, reducing that risk of the complications, again, like I've said, heart disease and strokes. I'm like a broken record. Question 2, what should my blood pressure and cholesterol levels be? So, blood pressure and cholesterol are two important numbers to watch when you have diabetes. As of the making of this video, the ADA and the AHA recommend that most people with diabetes aim for a blood pressure under 130/80 and an LDL cholesterol level, which is that bad cholesterol, below 100. Please take note though, these targets can vary based on your health and there are different guidelines that your provider will be using. So it's important to ask your doctor, what should my blood pressure and cholesterol levels be? And your provider might go over how high blood pressure and cholesterol can increase your risk for heart disease and strokes. Again, broken record. And the role of diet and exercise in keeping these numbers in check and whether medications like statins or blood pressure medication could be helpful for you. And they can go over how stress management and reducing salt intake can play a significant role in keeping your blood pressure stable as well. So briefly, here's how diet and exercise help. When you eat that heart healthy diet, like fruits and vegetables and whole grains, it provides nutrients that reduce inflammation in your blood vessels and prevent cholesterol from sticking to the walls, which then lowers bad cholesterol levels. So cutting back on salt too helps because too much sodium or salt makes your body hold on to water. It increases blood pressure as a result. Exercising, that strengthens your heart. It makes it pump more blood efficiently, which reduces the pressure on your arteries. It also burns fat, which helps to improve those cholesterol levels and even makes your blood vessels more flexible, improving overall blood flow. Knowing your specific targets and how to reach them helps you stay on top of these key risk factors. The closer you are to those targets, the better protected your heart will be. Question 3, what lifestyle changes will benefit my heart health the most? Well, managing diabetes and heart health isn't just about medications. Lifestyle plays a huge role. I'm a total advocate for lifestyle changes and lifestyle management to manage chronic conditions in the first place because it is by far often the first line treatment for most chronic conditions management and often offers results without having to deal with the side effects that most prescription therapy carry anyway. So a great question to ask your doctor is, what lifestyle changes will benefit my heart health the most? And they might suggest a variety of approaches that I've mentioned already, but let's go over these very briefly. Again, like I said, adopting that heart healthy diet, so nutrient-rich foods like fruits and veggies reduce inflammation, they stabilize your blood sugar, and they prevent cholesterol buildup in your blood vessels. So avoiding processed foods and unhealthy fats helps to lower your bad cholesterol and keeps your arteries clear. So then increasing physical activity, like I mentioned, exercise strengthens your heart. It makes it pump blood more efficiently. It also improves your cells' ability to use insulin, helping control blood sugar while managing weight, reducing the strain on your heart overall. Managing stress more effectively. So stress releases these hormones like cortisol that can raise blood pressure and blood sugar. So techniques like mindfulness or deep breathing and yoga, those kinds of things lower these hormone levels, helping to protect your heart and stabilize your blood sugar. If you're a smoker, then quitting smoking is one important thing to do because smoking damages your blood vessels, it increases your plaque buildup, and it reduces oxygen in your blood. So quitting reverses these effects, improving circulation and lowering your risk for heart disease and stroke. Getting enough sleep, that's a big one. Sleep helps your body repair blood vessels, it regulates blood sugar, it controls stress hormones, and poor sleep disrupts these processes, raising your blood pressure and then your heart disease risk. Staying hydrated. So proper hydration keeps your blood thinner and flowing smoothly, which helps maintain stable blood pressure and supports heart function. So following the ADA's guidance, even small steps like cutting back on processed foods, adding more lean proteins to your diet, and getting at least 30 minutes of activity most days can make a huge difference. And it's really not about being perfect. You just want to be able to be consistent in making choices that really support your heart and help you feel better in the long run. So anyway, this ends the part 1 of this 2-part video. So please keep a lookout by hitting that bell to turn on your notifications for the second part of this topic. Taking care of your heart while managing diabetes is so important, and these questions are a great starting point for having that conversation with your doctor. Understanding how diabetes affects your heart and taking proactive steps can make a big difference in lowering your risk for any of those complications I've already mentioned. Be mindful, these questions are not exclusive, but are ones that I've experienced most folks have repeatedly asked, whether they are chronically dealing with diabetes or are newly diagnosed. Remember, in this channel, I help you take control of your health by guiding you through questions and strategies that really encourage you to have that better communication and hopefully enhancing your relationship with your provider. Ultimately, though, I always advocate for lifestyle changes too when I can mention it, because in addition to it being first-line therapy for diabetes, by far this alone can vastly improve your health anyway. If you found this helpful, please hit the thumbs up and the bell so you can know when a new video is published. Also, please subscribe, share to help others, and then drop a comment below. I'd like to know what your experiences have been, or if you have any questions you might ask your doctor about your diabetes management. And thanks for watching, my friends, and see you in the next video where I continue on part 2. Be well and chat soon.